Good morning. We're going to look at a couple NCLEX style questions and see if we can break them down to get the correct answer. Question number 1. The nurse cares for a patient 4 hours after admission to the neuroscience unit due to a closed head injury. Which of the following is the most important action for the nurse to take? Number 1, assess pupil shape and reactivity. Number 2, take the patient's rectal temperature. Number 3, assess blood pressure and apical heart rate. And 4, observe the patient's oxygen saturation level. First thing we should do is break this question down to help us determine the correct answer. We break it down by looking for the key words or phrases contained in the question to give us more information. So we can ask ourselves, first, what are they looking for? What do you think? Yeah, they're looking for the most important action. So that becomes a key phrase. Second, what is the issue or problem with the patient? They have a closed head injury. And what type of problem is this? What type of problem is a closed head injury? Well, it's a neurological problem. So using critical thinking, what are we concerned about with a patient with a closed head injury? Yeah, increase in the cranial pressure. So, neurological problem, closed head injury, the fact that he may have possible increase in intracranial pressure become important concepts in this question. Lastly, at what stage of the disease are we at? By that I mean, is this a new problem? Has this been an ongoing chronic problem? It's been hospitalized for some time? What do you think? Yes, he's in the early stages. It's only been 4 hours, so that's considered early stages of a closed head injury. So let's reword the question using the key components now. You should do it in your own words, in your mind. Our key components are most important nursing action. We're looking for the most important nursing action. It's a neurological problem. It's a closed head injury and a possible ICP increase, and the fact that the patient's only been there for 4 hours. So using the key components, we can reword the question to something like this. What is the most important neurological nursing action that should be taken to look for a possible increase in ICP for a patient who has been admitted 4 hours after a closed head injury? Now we can move on to the answers. When we look at answers, we should be asking 2 questions. Is the nursing action pertinent to the problem or issue? In this case, we would ask if this assessment is part of a neurological assessment or an assessment important to a closed head injury. Number 2, what information does the outcome of that particular assessment tell us? Is it pertinent? If not, we can throw the question out. Keeping these questions in mind, let's look at the answers. Number 1, assess pupil shape and reactivity. So yes, is this assessment part of a neurological assessment? Yeah. Would the outcome of this assessment tell us anything about ICP? The answer is yes. A change in pupil size, shape, or reactivity is an early sign of intracranial pressure increase. Let's move on. So we would keep this one. Number 2, take the patient's rectal temperature. Again, is this part of a neurological assessment or an important assessment in closed head injury? The answer is usually not. And what would this particular outcome tell us of this assessment? Anything about ICP? Well, a temperature elevation can be due to other injuries or other things. It could be a sign of increased ICP, but it would be a late sign. So we can throw this answer out. Number 3, assess blood pressure and apical heart rate. Again, is this part of a neurological assessment or important assessment to do with a closed head injury? The answer is it can be. But what would the outcome of this assessment tell us? Would it tell us, again, anything about the ICP of the patient? The answer is no. Changes in vital signs are late signs of increased ICP. It's only been 4 hours, so we would throw this one out. And number 4, observe the patient's oxygen saturation level. Again, is this assessment part of a neurological assessment or important to a closed head injury? Well, it is. It's an important data point to have for a patient. But what would the outcome of this particular assessment tell us? Would it tell us anything about the ICP? Well, it does. It can. If you have a high CO2 level, it can increase intracranial pressure. So we probably keep this answer too. So looking at the two possible answers that are left, we have to decide which assessment is the highest priority. And what would your answer be to that? Of course, answer number 1, assessing the pupils, because it's the quickest way to check for increased intracranial pressure and is considered an emergency, and a physician should be notified immediately. So let's move on to question number 2, which is, the home health nurse plans a visit for patients. The home health nurse plans patient visits for the day. Which patient should be seen first? Again, let's figure out what type of question this is, and then we apply this appropriate strategy to find the correct answer. Let's look at the question. The home health nurse plans patient visits for the day. Which patient should the nurse see first? When you see words like first, most important, higher priority, sickest, the question is a prioritization question. Priority questions are all about the stability of the patient, and in this question, the keyword first tells us that we are looking for the least stable or the most acute patient. That is important to see first. So the strategy for priority questions is to look at each answer and ask, is the patient experiencing something unexpected, something new, a change in condition? If the answer is yes, it could indicate that the patient is not stable, and we would keep that as a possible answer. So let's look at these. Let's look at the answers. Again, rephrase the question in your own words. The question becomes something like this. Which patient is the least stable and needs to be seen first? Simple as that. Number 1, a 70-year-old diabetic with a fasting glucose readings of 240 to 260 for 1 week. So we ask, is she experiencing something unexpected? Is there a change in the patient's condition? Is there a new onset of late sign or symptoms? Well, what's a normal fasting glucose reading? Between 70 and 130. And the readings have been between 240 and 260, which is high. So there is an issue with this patient, and it could be a possible answer. But let's look at the other answers. Number 2, a 65-year-old discharged from the hospital 2 days ago following coronary bypass graft surgery. So is this patient experiencing something unexpected, a change in condition, a new sign or symptom? Well, he would not have been discharged if he was unstable, and the answer didn't indicate that there was anything going on. Will probably require assessment and some teaching, but we can throw this answer out. He's a stable patient. So let's continue to the third one. A 55-year-old with congestive heart failure who gained 3 pounds in the last 24 hours. So is this patient experienced something unexpected, a change in condition, new onset of sign or symptoms? Well, the answer is yes. He's gained 3 pounds in 1 day. And as indicated in the question, the patient has CHF. So what is a 3-pound weight gain in a patient? What does a 3-pound weight gain usually mean, especially in a patient with CHF? Well, the answer is that he's retaining fluid. So there is an issue with this patient, and this could be a possible answer, so we'll keep this one for now too. Let's look at the last answer. 4. A 40-year-old with metastatic breast cancer complaining of pain unrelieved by pain medication. So is she experiencing something unexpected, a change in condition, or a new sign or symptom? Well, pain is not unexpected in cancer, and there's no indication that the patient is unstable. Yes, there's a change in her pain, but the pain itself is not a new issue. The patient is stable and her pain control can be addressed when you see her, but we can rule out this answer. So that leaves us with the 40-year-old diabetic woman with the high glucose and the 55-year-old man with CHF who gained 3 pounds in a day as our possible answers. So we ask, who is the most critical, or which one is the most unstable of these two patients? What do you think is the most acute between these two? Yes. The rapid weight gain indicates fluid retention, which could exacerbate CHF, which could be life-threatening. So number 3 would be the correct answer.